Breast cancer vlog, day 72. It has been a month since I had my breast removed, a double mastectomy for breast cancer. I was diagnosed with ductal carcinoma in situ, and yes, they did find cancer in my left breast. I chose to have both breasts removed because I wanted to reduce any odds of it occurring in my right breast as I got older. And boy, has it been a journey. It has been a journey of stress, emotional upheaval, a lot of tears, a lot of crying, a lot of fear. And now that a little bit of time has passed, it's like I'm a bit calmer now. I'm kind of embracing my inner hippie. It's like no makeup, long hair, barefoot, jeans. You know, I don't need to please anybody right now. I just want to heal, and that's my goal, to heal. But here's something that's I'm finding quite interesting, and that is that I'm an educator. I have dedicated my life to educating people about pelvic pain. I encourage everybody to read. The more you read, the more you know. The more you learn about it, the better decisions you'll be able to make, right? I'm finding that I don't want to read about breast cancer. It's like there's a part of me that says, if you don't read about it, it's not real. Now, obviously it's real. I've had the surgery, yada, yada. But what I've been trying to get a grip on is all the pain that I've been having. And it turns out that I have post-mastectomy pain syndrome, which is basically, you know, really damaged, irritated nerves. And so there are times when I have to walk around like this, like I can't let anything touch the incisions, they're so sensitive. And so this morning, after I woke up this morning and I was cruising through the internet and I Googled post-mastectomy pain syndrome, like, I didn't even want to read about it. I did, not a lot. I read enough. Why is it that way? I mean, and I think it's reminding me why some people don't want to read about their other conditions, the conditions that I might be able to help them with. Is you just want to escape. You just want to not talk about it. You just want to pretend for an hour or a day that your life is normal again. Right? Does that make sense? I think that that's due to the emotional trauma that we're going through when we struggle with pain. And there are times when it's okay to check out. There are times when it's okay to sit in a corner with an Afghan and a book or cruising TikTok. And there are times when, if you're not getting better, if something is going wrong, you cannot be passive. You have to be active. You have to email your doctor. You have got to call your doctor. So as an example, I was working with somebody a couple weeks ago. Again, I'm averaging about 1 or 2 patient talks a day right now because I have good moments and bad moments. So anyway, I was talking with somebody who shared that her sister had found a lump in her breast. And it wasn't a little lump, the big lump, like the size of a walnut. And she still hadn't gone to the doctor to get a check because she was afraid of the diagnosis. Don't do that. If you notice anything unusual, go to the doctor. Get it checked out, because the earlier they find it, the easier it is to treat. So I understand those moments when we need to check out. I understand those. But we got to pull ourselves up, stand up, and ask ourselves, are we getting better? Are we getting worse? Is there anything that we're worried about? Is there anything that we're scared of? Is there anything that is upsetting us and bothering us about our health? If that's the case, we have to ask for help. And it's okay to ask for help. It's really okay. What do they say for breast cancer patients? If you notice anything funky, call your surgeon right away. And I'm really embracing that. So I guess what I just want to remind you guys of today is that you've got to learn. We've all got to learn. How we choose to learn is our choice. We can read about it, we can watch videos. Usually it's a combination of both that work the best. And of course, you can talk to other people, especially experts who are knowledgeable in their field. But don't let fear stop you from getting the care that you need. Don't let fear stop you from addressing something that's painful that might actually be very, very fixable. I once worked with a patient who had pain for 5 or 6 years, and finally when she asked her doctor to look, they found the problem super, super easy. They could have fixed it in one visit 5 years ago. She suffered for 5 years needlessly because she was afraid of the doctor. Don't be afraid of the doctor. They're there for you. All right? So that's it. I'll see you on the other side.